Welcome to Stage Explorations, where we interview the theater creatives and artists from the theater world, those who perform on stage that the audience sees, and those behind the theater stage that the audience almost never sees. I am a journalist and theater fan, Buell Brown, and today's guest is...
I'm Victor Valcour. I'm the Executive Director for the Global Brain Health Institute and the Atlantic Fellows for Equity in Brain Health, as well as Professor at the University of California, San Francisco. If you'd like to learn more about our institute or the play, watch this video.
My first question is, when was the Global Brain Institute created and what is its main mission?
The Global Brain Health Institute started in 2015 to enroll fellows. We began thinking about it back in 2013, maybe even before that. The idea is that across the world, dementia is a grand challenge. It is increasing in frequency around the world, largely in low middle income countries because these countries have aging populations. And dementia is one of the most costly diseases in the world. It costs in the United States more than the total cost of cancer, heart disease, and stroke combined. And a lot of the costs are informal costs, so they're taken up by caregivers, families. Oftentimes people have to give up their jobs to caregive for families, and oftentimes the people giving up their jobs are women. Just one of the many inequities in dementia care. The inequity in the fact that much of the increased prevalence of dementia will be in low middle income countries that may not have economies to support these costs. Also the inequities in the disease itself, which seems to be more frequent in women. And then the inequities of care. We haven't even started with the determinants of a healthy brain, and the social determinants of a healthy brain are linked to disparity. So we really are an equity program, and that's why our core training program is called the Atlantic Fellows for Equity in Brain Health. And the Atlantic Fellows for Equity in Brain Health, now we have over 140 fellows from more than 40 countries that spend time with us, using an equity lens to understand dementia and how we can approach this grand challenge. But it's to promote health for aging populations around the world.
As a founder, what is your hopes and goal for the Institute?
We're a global program and we're an interdisciplinary program. And as I said, we're an equity program. So our primary goal is to train the next generation of leaders to address this grand challenge worldwide. We hope to train as many as 600 leaders around the world to address the issue of brain health, and particularly in communities that are underserved, otherwise don't have access to care, to address major challenges in those areas. To date, 140 fellows in over 40 countries is quite an achievement. Each of the fellows spends a year with us, and as I've mentioned before, they come from every discipline you could imagine. And this is why the arts are so critical to us. We have artists that come into our program, and they are absolutely critical, not only in therapeutic sense, but in advocacy and awareness. Our partnerships, for example, with the San Francisco Conservative Music increases our stage of awareness of diseases. And plays like UnRavelled increase awareness of these diseases that affect the brain in a way that we capture audiences that we otherwise wouldn't be able to. To be able to firmly address this grand challenge, we need everybody. Anybody with zeal, anyone with energy, anybody who is trying to address this issue from whatever lens, whatever approach they're coming from, to come together and create a community that is working collaboratively.
Tell me about the Hellman program and how did that lead to UnRavelled?
The Hellman Visiting Artist program has been around in the Memory and Aging Center for many years. This has been an incredible opportunity to bring artists into the space of our Memory and Aging Center. The Memory and Aging Center is a leading center for clinical care, education, and research in the United States. And by bringing in artists, we do many different things. It helps us to think better about our research. It helps us to think better about our education approaches, and certainly has helped us with understanding the lived experience of dementia and the work that has been done. But I also think it's nurtured us as investigators and as clinicians, brings us together with common themes, and nurtures, keeps us healthy ourselves. This is a brainchild of my boss, Dr. Bruce Miller. who has always had a lens of bringing in the arts into the work that he's done. Since the day I joined the Memory and Aging Center 15 years ago, this has been part of his narrative. It's also quite instrumental in how it formulated our approach to the Global Brain Health Institute, which sits in the Memory and Aging Center. I credit to a large degree the multidisciplinary approach that we're taking to brain health protection strategies, to the experiences that I've had, particularly with the Hellman Visiting Artist program, but through the values that Dr. Bruce Miller has held and brought to the programs at the Memory and Aging Center.
Just tell me as much of the history as you know about the connection between Miller, the playwright, and how this play came about.
I know a little bit about the relationship with Jake Broder and Dr. Bruce Miller, but I'm certainly not an expert on this. The content of the play has been around for a long time. Dr. Bill Seeley and Bruce Miller published a paper in this space. I think around 2005, I had read that paper as an early faculty member at the Memory and Aging Center. And it essentially talks about the story of this play, an individual whose art changed substantially in the setting of a neurodegenerative syndrome. And what was really very exciting about it, I don't know if I probably shouldn't give the punchline away. You need to come and watch the play because there's a twist that connects this patient and the art that she creates that is just unmatched and almost gives you goosebumps thinking about it. We have leveraged this story for a large event in San Francisco, and I think Jake Broder had become interested in it before that and really wanted to bring this to the stage. And I think part because of the exciting story that underlies it. To us, it really highlights the emergence of creativity in the setting of neurodegenerative disorders, and is a really strong advocacy platform for us to raise awareness of these neurodegenerative disorders.
Why is it important that this story is being seen online for free for the public? Why is it so important to be seen?
It's important that this program be seen online for a large audience because it will help us to raise awareness with larger audiences than we can get into one performance, and certainly magnitudes of cost saving and scaling that are possible. So I'm particularly excited about this and our ability to share it worldwide. One of the showings will be in connection with an international conference on dementias, and I hope that will bring in a large international audience. The added benefit there as well is an opportunity for the Global Brain Health Institute to lead in the narrative that arts are critically important in our mission to protect the world's aging populations from threats to brain health. That's critical for us, that we lead and show by example how important it is to work with all groups of people to advance our mission of protecting the world's aging population from threats to brain health.
What do you want the audience to get out of the play?
Well, I think the audience will certainly get an incredible entertainment opportunity. The storyline is one that has twists and turns, and as I mentioned before, almost gives me goosebumps thinking about how this all comes together. I understand that the actors are phenomenal, so I'm absolutely certain the performance will be amazing. I also think that the people who watch the event will learn a little bit about specific neurodegenerative syndromes, that dementia can present in many different ways, not solely with loss of memory, but can present with behavioral changes, can present with language changes. So that degree of awareness, I think, will be very important for people to get out of it. And as I mentioned before, I think the intersection between science and the entertainment of this opportunity is also critically important in terms of a mechanism, a narrative in which we can increase awareness broadly, working together collaboratively across silos, not within our silos.
Why must or should people watch this play?
People should watch this play to learn a little bit about a neurodegenerative syndrome and also to be entertained by a really fascinating story, to learn a little bit about the possibility of emergence of creativity in the setting of neurodegenerative disorders. There are many compelling reasons to watch this. I'm particularly excited to see the quality of the performance, which I'm absolutely certain will be outstanding, and the entertainment value of this will be incredibly high, and at the same time, an educational opportunity.
Why are local research hospitals and local theaters so important and needs the community's help and support?
Local community theaters and hospitals being together as a needed contributions to our communities. It's an interesting mashup. We've certainly seen recently with the COVID epidemic how critically important it's been to have outstanding hospital systems in our community. And particularly here at the University of California, San Francisco, we've been incredibly fortunate to have some of the brightest minds addressing this huge challenge. And I think the community services is really quite amazing. The arts are just as critical to a healthy society, to a healthy community, to be able to elevate narratives and to bring people together in a way that is inspiring and collaborative. I think both. It's interesting to see the mashup in your question of including both the hospital systems and local theaters, and they're both critically important for, in some ways, many of the same reasons, nurturing a healthy society.
Is there anything I missed out you want to mention about the Institute or about the play that we think people need to know about?
The Global Brain Health Institute is located both in the University of California, San Francisco, and in Trinity College in Dublin. This partnership of two founding sites supports the training of international fellows, Atlantic fellows, from every discipline that you can imagine, including arts, anthropology, nursing, clinical care, like neurologists, geriatricians, neuroscientists, and entrepreneurs of different types. We bring people together every year, about 40 at the two sites, and they spend a year together trying to create a network and a community. And I like to think of it as a think tank where they learn and think with each other about the challenges in their community. And by learning across disciplines and across regions, novel ideas are bound to come up. We champion our Atlantic Fellows to achieve change in their community, which I think is a novel way of addressing a global challenge. Instead of coming up with the solutions, we don't do that. We create a lot of content and opportunities for them to create solutions that will work culturally within the communities that they work in. And this is a really strong piece of what we are at the Global Brain Health Institute. If you've enjoyed this discussion and want to learn more about our institute or the play, join us, occurring online and open to all.
Thank you for listening or watching this podcast episode of Stage Explorations. To learn more about the theater creative and more theater creatives and artists on Stage Explorations, go to www.stageexplorations.com. Once again, that is www.stageexplorations.com. There is no space between stage and explorations. You may find more videos, podcasts, and information about this theater creative and other theater creatives and artists on Stage Explorations YouTube channel. Looking forward to seeing you in the theater.